Well, a warm welcome back. It's still Thursday the 31st of March. Hope you got a chance to watch the Africa update video with lots of lessons to learn for us all over the world. Now, the main question I'm asking in this video is the United States going to follow the UK and Europe in this immense Omicron, and especially the Omicron BA2 surge in cases? And I think it might be. So let me just quickly run over the reasoning here. Now, this is the prevalence now. 4.4 million people are predicted to have symptomatic COVID-19 in the UK at the moment. 349,000 new cases in the day, and the graph is still going up. Now, you could argue that the rate of increase is not as steep as it was, but it's still going up. Quite incredible. How long can this go on for? The answer to that, I think, is not very much longer. We're near the peak. Now, let me show you my reasoning here. This is the UK. So England, now this red line here is cases of BA2, Omicron, of course, and the blue line is cases of BA1 Omicron. And we can see that the BA2 has well and truly replaced, or is replacing, the BA1 in England, Wales, Northern Ireland. It happened earlier, as we looked at before, and Northern Ireland surged earlier because of the BA2. And also in Scotland. And also we noticed that Scotland has the highest proportion of BA2 compared, so that's BA1, that's BA2. And also Scotland has by far the highest number of cases per capita at the moment. Now let's look at the United States now, just to compare that. Now here we have here, this is the latest CDC data. So that's BA11, that's another strain of Omicron there. These are all Omicrons, of course, they're just different strains. But what I want us to notice here is the more transmissible BA2. So it's increasing week on week, and dramatically so. And as it increases, the other forms are decreasing. So no question that BA2 is dramatically increasing in the United States. Of course, we've predicted this for some time. It was inevitably going to happen. And it looks like this is going to result in increased cases. Now, let's contextualise that. Cases are falling swiftly in recent weeks. Now, BA2 at the moment in the States is 54.9% of cases. Of course, this is always out of date, so it's higher than that now. I think we can safely say it's 60% of cases, or even more than that now. In the States as a whole, it's good to see here that cases are down 9% in the last 14 days. Quite a good reduction. But New York City cases up 62% in 14 days, and New York State cases up 65%. So we see a sharp difference here, sharp increase in New York compared to the overall national decrease. So 9% down nationally, but locally up by large amounts. Now, it looks to me that this is the start of the Omicron surge. And I would expect other areas to follow this. Now, it's a bit disappointing because the US is basically on getting over the pandemic now. So US exit strategy. Now, of course, US doesn't do exit strategies particularly well, as indeed neither do we in the UK. But social life is largely returning to normal from what I can judge from the States. Sport events, concerts. Illinois stopped free testing centres. And these states have actually stopped giving out daily data now, although they are giving out weekly data, which is good. Now, President Biden has just had his booster shot. And I'm going to try and show you this now.
What did President Zelensky tell you about?
Somebody asked about the vaccine. Wonderful.
Mr. President, what did you hear from President Zelensky today about negotiations with Russia?
There we go. President Biden receiving his fourth shot. I don't think I've ever seen anything so undignified in my life. There's a medical procedure going on, and it sounded like complete chaos in the background, as if there was going to be any meaningful interaction during that. I must say, I found that quite appalling, the disrespect to that healthcare provider there. Having said that, Mr. Biden rolled his sleeve up, and if you roll your sleeve up, you just can't get it high enough. So it looks to me like his vaccine was given too low into the tail of the deltoid. It should be up into the body of the deltoid, where you actually need to get the access there. She simply couldn't get it because he was wearing a business shirt. And, of course, she didn't vaccinate. Now, to be fair to that particular vaccinator, that is the policy in the United States, not to aspirate. It's just that we think that policy is wrong. I think that policy is wrong. The Danish authorities think that policy is wrong. The German authorities think that policy is wrong. I think that policy is wrong. And most of you think that policy is wrong as well, from the feedback that I get. So no criticism of the injector there for not aspirating. It's just policy. But it needs to change, in my view. So there you go. President Biden's had his, that's his fourth shot. So the second boost shot, fourth shot. And next time, let's hope healthcare is provided in a slightly more dignified environment. I've just found that very disrespectful. So that's the situation in the United States. Now, I'm going to show you a graphic here from Australia. Now, here we have the situation in Australia. Obviously, total cases going up, but we've definitely got a surge there. So these are the daily reports. So there's definitely an increase in cases in Australia, but I think we were aware of that. Now let's look at a little more data here. Australia, obviously the cases are increasing, but New South Wales active cases, Western Australia, high. What I'm looking at here mostly is the new cases. So Western Australia, which has opened up more recently, high numbers of new cases. South Australia, which is behind in the pandemic, high numbers of new cases. But New South Wales and Victoria, where the Omicron has been spreading for longer, lower numbers of new cases. So pretty confident there that Australia is getting over this. And there the age, COVID-19 deaths by sex and age, which are roughly as we would expect, so no major changes. So I think this data here is showing us that Australia is getting over this, surge, which is what we would have expected. So I think that's quite encouraging news from Australia, really. Now the UK, we've looked at the COVID symptom tracker data, which is still very, very high. That's the data there. Now, the government funding's actually been withdrawn for this study inexplicably, but they are going to struggle on for at least a good few weeks. This is the Office for National Statistics data, which is carrying on. Now, it's incredible. England, it's 1 in 16 people currently infected. This is the prevalence. Wales, 1 in 16. Northern Ireland, 1 in 17. Scotland, 1 in 11, despite the stiffer restrictions in Scotland. Now, thank you for all the people that have asked about me, which is always it's nice to know that people are interested. I've actually felt a bit rough this week, feel a bit better now. And I've tested 3 times and it's always come out negative. So it looks like, I don't know. I really don't know. Tim Spector says you can have it even if it's you can still have it even though you're testing negative. So this is my last test. Now it's a bit strange actually. So here's my last test. So we've got the control line there, of course, which is absolutely fine. Now after half an hour there was no line there at all, and yet it's come up over the few hours. So technically there's no question about it, this was a negative test. And yet I am kind of getting a bit of a formation there after an hour or two. So it does say that the test people do say don't read it after half an hour. So I read it after half an hour and it was negative. But I'm just a bit curious as to whether that is indicating a very low viral load that's taken an hour to come up. But can't say that. All I can say is according to the test instructions I was negative. So I'm as confused as you are. But I've had a few of the classic symptoms that Tim Spector's told us about recently. The sort of classic list of symptoms that the government seems to ignore. So there you go. Make what you want of that. Anyway, Office for National Statistics data, things we can be more sure of. I'm too zoomed in now. There we go. But people were more likely to test positive for COVID-19 in the 2 weeks up to the 12th of March if they. Now, this is interesting. had not previously been infected, well, of course, you're more likely to be infected. So remember, this is people that are more likely to test positive. If you'd not been previously infected, of course, you wouldn't have natural immunity. So obviously, that is showing us the benefit of natural immunity. Travelled abroad, well, if you've ever been in aeroplanes, you know you're all stuffed into a cabin. So it doesn't mean, say, they picked it up abroad. Most of these people could have picked it up on the flight because aeroplanes are classic. I mean, every time I fly, I always get a bit of a respiratory infection, even before COVID. It's just, you're just re-breathing people's bugs so much of the time. Reported being white ethnicity. Is it that other ethnicities have already had high exposure and therefore have generated some community immunity? Probably. Don't really know the answer to that question though. Were employed and working. Well, again, reasonable that people could get more infected at work. Now, this is interesting. People were more likely to get infected if they'd not been living in a multi-generational household, indicating to me that people who do live in multi-generational households have been more infected in the past, therefore have more herd immunity. Men were more likely to be infected, don't know why that is. Were not impacted by a disability, so again, have these people largely had the infection and developed some immunity already? Possibly. People were more likely to test positive if they worked in a care home. So is there still spreading in care homes? That would seem to indicate that. Particular demographics, of course, that's not surprising because different demographics tend to interact and can get the infection at different times. Had not had contact with hospitals or living in a person in contact with a hospital. So again, indicating that people who work in hospitals or have contact with people who worked in hospitals have already had the infection and therefore are less likely to get it this time around. Again, to me, indicating the importance of natural immunity. Now, the Office for National Statistics don't say that. That's just me thinking out loud. But remember, this is the Office for National Statistics saying people were more likely to test positive in the 2 weeks if they had those characteristics. So I think that is indicating that there's a lot. We're seeing the effect of community immunity. I believe we are seeing that now. Reinfections are around 10 times higher with Omicron variant than in the Delta period. So we can say here Omicron is 10 times more likely to cause breakthrough infections. Reinfections 10 times more common with Omicron than with Delta. Definitely Omicron is causing more reinfections, particularly the BA2 is more infectious. And this is another reason why I strongly suspect we are going to see a surge in the United States because the BA2 is progressively, rapidly increasing in the United States. So I do think we're going to see that uptick in cases in the States. Maybe not necessarily following such a high prevalence as New York, but I'm afraid it's probably in that direction. Risk of reinfection was around 10 times higher in the period when Omicron variant was most common, which was 20th of December to the 20th of March 2022, compared to the period when Delta was most common, 17th of May to the 19th of December 2021. So 10 times difference with Omicron. You could argue that that's good because, okay, more people have been hospitalised, but many of those are with Omicron rather than from it. And, of course, it's generating lots of immunity as it goes. You can kind of see it both ways all the time, can't you? Between the 2nd of July, the 2020, and 20th of March 2022, people were more likely to be reinfected if they were unvaccinated, indicating that vaccination is providing some protection against reinfection, although we know we've been, especially with Omicron, there's been a high rate of vaccine breakthrough infections where people are getting symptomatic infection after vaccination, particularly with Omicron, and as we've seen, 10 times more so than with Delta. Had a milder primary infection. So now, as far as I know, the Office for National Statistics, they can get an inference of viral load from the PCR test. So if people had a milder infection with a lower viral load, then they're more likely to get reinfected, indicating that a higher viral load produces more natural immunity. Interesting, and this is new. This is the first time this has been definitively stated. So more seriously symptomatic infections with a higher viral load are generating higher levels of immune longevity. We could strongly speculate from this data. Younger people more likely to get reinfected. Interesting. Can't really think why that is at the moment. Lived in more deprived areas. We've seen this as a trend throughout. So are we at the peak, or are we, is it going to go on climbing forever in the UK? Sir Patrick Vallance, Chief Scientific Officer, we've got very high levels of infection at the moment, obviously. I think the number of infections is beginning to turn. Well, not at the moment, actually. It's not. It's not. It's not. We've seen that from the COVID symptom tracker data. Infections are still going up at the moment. Still going up. So they're not unless I don't know. I can't work out why I said that. They're not beginning to turn. Unless he's got some Office for National Statistics data that hasn't been released yet, which of course he could have. But the rate of increase is starting to decrease. I'll give him that. But anyway, not quite sure. But the thrust of his argument, and I think we have to accept this, is that cases will be going down soon. He thinks that we're starting to go down, beginning to turn now. I don't think we're beginning to turn for another week or two. From what I can gather from the essentially live COVID symptom tracker data. But it will be going down soon. I think we can say fairly definitively this time next month cases will be going down really quite dramatically, following the Danish model, following the Hong Kong model. We've seen this before, so quite confident to predict cases will be going down dramatically next month, but probably still going up next week and then levelling off the week after would be my prediction. And the United States, of course, could have all this BA2 wave to come, as per the New York data, potentially. Is that going to result in huge numbers of hospitalizations? Probably not, because the number of hospitalizations have gone down so dramatically in the United States, which of course is excellent news. More from Sir Patrick. Need to look back, assess and dissect lockdowns. So he's openly questioning how effective lockdowns were, because we need to dissect that, he's saying. Clearly there were detrimental effects of lockdowns and should not be undertaken lightly in the future. So a definite air of retrospective analysis there from Sir Patrick, which of course is good. That's how science progresses. So that's the thinking so far. I'm pretty confident we're going to see an increase in numbers in the States. How important that is in terms of hospitalizations, hopefully minimal, but it will generate large amounts of community immunity in its wake. So it's good and it's bad, but I think it's more good than bad, because we have to learn to live with this infection, as indeed the United States is already. But it still has the BA2 hurdle to get over, as indeed we are currently straddling in the UK. But be assured that we've got data from Hong Kong and Denmark particularly, who are over, and it does go down quite dramatically once a large number of people in the population have been exposed and infected. Okay, if you've got any thoughts on my test, do let me know, because I really don't know. I mean, you know, if you just seen that, it does look like a positive test. But as I say, that line did come up more than an hour after I did the test. So I really don't know. No, I do know it's a negative test. It is a negative test because it wasn't there half an hour. But it's just curious that it's come up after. But we have to say it's a negative test as per the manufacturer's instructions. So there you go. I have not yet been knowingly testing positive. Thank you for watching.